Hi everyone! In this video we'll be talking about sexual anatomy. We know that discussing your kiddo's sexual anatomy can sometimes feel uncomfortable. We ourselves were maybe taught to call our genitals by words like down there, private parts, cookie, or ding dong. But it's super important that we teach our kids the medically accurate terms for their body parts so we can normalize sexual anatomy as natural parts of our bodies that we don't need to be ashamed of. Knowing specific language for sexual anatomy helps prevent and treat common sexual health concerns like infections, lice or other parasites, unplanned pregnancies, and sexually transmitted infections, or STIs. Kids with knowledge of their sexual anatomy can clearly identify what is itchy or hurting. They can understand how pregnancy works and how to prevent it until they're ready, and they can avoid STIs by knowing which behaviors and body parts are most at risk. Knowing specific language for sexual anatomy also helps avoid and identify cases of child sexual abuse. So it's crucial that we put our embarrassment aside and help our kids learn the words that can help keep their bodies safe and healthy. Here's a quick sexual anatomy review lesson for everyone. And warning, we'll be showing some visual diagrams of sexual anatomy. First of all bodies are unique, and that's great. Some babies are born with a vulva, some are born with a penis, and others are born with something in between. Some people have a uterus, an organ the size of a fist, below the stomach with two fallopian tubes that carry eggs from two ovaries. We are born with all the eggs that we'll ever have, and they develop in the ovaries until puberty, when 1 or 2 eggs are released each month during the process of menstruation. The egg travels down the fallopian tube until it either meets with the sperm or exits the uterus with the uterine lining as period blood. The period blood passes through the opening of the uterus called the cervix, and then through the strong and stretchy tube called the vagina out of the body. The outside is called the vulva, which is made of folds of skin called labia. These labia cover and protect the 3 openings underneath: the clitoris, the urethra, and the vaginal opening. The clitoris is a bundle of nerves shaped like a wishbone with a highly sensitive tip and legs extending on either side of the vaginal opening. Its purpose is purely for pleasure. Urine, or pee, exits from the urethra, and the vaginal opening, as it sounds, is the opening of the vagina that extends inside to the cervix and the uterus. The anus is the opening below the vagina where poop exits the body. Some people have a penis, a cylindrical shape made out of spongy tissue that hangs on the outside of the body. All babies are born with skin covering the penis called the foreskin. Some parents choose to have this removed at birth. 2 testicles hang below the penis within a sac made of skin called the scrotum. The testicles produce sperm needed to start a pregnancy. A tube called the vas deferens connects the testicles to the body parts on the inside. These include the prostrate, seminal vesicles, and bladder. Urine, or pee, exits the bladder and moves out from the penis through a tube called the urethra. During an ejaculation, when the penis gets hard or erect, sperm travel from the testicles through the vas deferens to the prostrate and seminal vesicles to get mixed with semen and then exit the penis through the urethra. Some people are born with ambiguous genitalia, or private parts, and are often called intersex. Intersex individuals are actually as common as redheads, and are born with differences in sexual development, either in their chromosomes, their hormone levels, or in their anatomy. It is difficult to show just one example of intersex anatomy because they're all so different. But here is one example to become familiar with the concept that not all individuals are born clearly male or female. Now that you're refreshed on the terms, how do you actually have this conversation about anatomy with your young person? Let's start with 5-year-old Andy, who asks you, "Does Barbie have a vagina?" When kiddos are young, it's important to focus on what they're actually asking. If we offer a shame-free space for them to ask questions, they'll continue asking us questions as they're ready. A sample conversation could look as simple as, "Does Barbie have a vagina?" "No, sweetie, Barbie is a toy, so she doesn't have a vagina." Maybe that's all your kiddo wanted to know. Maybe, though, they'll ask the obvious follow-up question, What's a vagina? You can answer simply and factually. Well, some people have a private part called the vagina that's between their legs. This is the inside part of the body that we can't see. The outside of the vagina is called the vulva. It's made of folds of skin called labia. Oh, I have that, exclaims Andy, trying to take off her pants. I know, and that's great. However, we call these private parts because they are for us alone until we are ready and old enough to share them with someone we trust. That's why most of the time they're covered up with our clothes. Sometimes our parents or doctors might need to touch our private parts to help us stay clean and healthy, and that's okay. But your vulva is for you. But my brother Adrian doesn't have a vulva, says Andy. Yes, that's true. Some people have vulvas, some people have penises, and others have something in between. And that's okay. Being different makes us unique and special. It's okay to point out the names of sexual body parts to your little one as soon as you start pointing out their toes. You can expand these conversations as your kiddo gets older. Share with them what these body parts do, and explain that some body parts are hidden inside us. Name them and talk about their role. Talk about what it means for something to be private. Discuss what your young one should do if their private parts ever hurt, or if someone touches their private parts without their permission. Approaching puberty, consider showing them some anatomy diagrams and describe how the body parts will be involved in menstruation and ejaculation. And don't worry, we'll have a video soon with tips on how to talk about periods. Just remember, it's important for your kids to know the medically accurate names of their sexual body parts. This knowledge can improve their sexual health, prevent child sexual abuse, and teach them not to be ashamed of the great bodies they have.